Indeed, we're facing a very tragic situation here in Lebanon since Monday and the intensification of the attacks that your report just outlined. We're seeing thousands of families with thousands and thousands of women and children in particular who are arriving to Beirut and other cities across the country in absolutely dire need. We're doing our best to distribute as quickly as possible. We have teams on the ground across the country distributing hot food. Yesterday, because the evenings now are getting colder, we're distributing mattresses, hygiene kits, and there's an urgent need for food and water on a daily basis. Many of the families that we're meeting fled just with the clothes on their backs out of the sheer terror that they were seeing in their communities as their homes and civilian infrastructure were being bombarded for hours, an incredibly intense escalation of the conflict. So we're doing our best to provide support to this severely traumatized population, including over 1 million Syrian refugees who have been hosted in Lebanon now for over a decade. So far, we've seen approximately 50,000 people displaced who have arrived to the shelters. Every day, every hour, there are more and more shelters opening. Currently, there are more than 250 that have opened across the country, but there's an urgent need for more because families and young children continue to arrive.
And of course, Lebanon was already facing multiple crises, an economic crisis. There was the Beirut port explosion. And the danger now for civilians is worsened by the fact that Lebanon's health care system is under-resourced and overstretched. Tell us about the realities that you're seeing there in the hospitals and medical centres. And do you think humanitarian aid will be enough to compensate for this?
Yes, indeed, this conflict is the latest crisis to impact Lebanon, which has already been devastated for the last number of years by a protracted economic and political crisis. So it's really, the conflict has really reduced access, we're seeing, to these essential services, such as health, as you mentioned, education and water. So it's really worsening an already dire situation for children and their communities. Now, children should be going back to school in their school uniforms with their new school bags. And UNICEF had been supporting the Ministry of Education here to reopen schools after the summer break. But tragically now, we have seen the postponement of the new school year until mid-October. So it means that hundreds of thousands of children are again going without an education as they seek safety in shelters and classrooms across the country. So we're seeing another interrupted school year. Indeed, the hospital situation is also dire. UNICEF flew in last week 100 metric tons of urgent medical supplies that are needed, but it's not enough. And many airlines have stopped flying to Lebanon. So now we're trying to urgently bring in at least 25 to 30 metric tons of medical supplies this week, which are so badly needed given the thousands that have been injured over the past 10 days. And many of these are children with very severe injuries. However, some children have not survived over the past 1 week, and unfortunately, they are still beneath the rubble. So family members that we've spoken to are devastated, having lost, in some cases, up to a dozen family members during the bombardment.
You mentioned the disruptions to schooling for children there. That's something that I wanted to ask you about. I mean, of course, families have been displaced since just after October 7 last year, because that's when these border clashes broke out. How have those displacements also impacted schooling for children?
Indeed, some of the children that have been displaced since last year have been learning online remotely. UNICEF, together with our international partners and the Ministry of Education, have opened hub schools so that children could go to another school. The schools were very generously opening their doors. We have distributed supplies, learning materials. We've opened community centres so that children can learn in whatever context is feasible, where they arrive or where they're displaced to. But it's really not enough, because already there was 700,000 children that were out of school in Lebanon, even previous to this crisis. So we're really seeing a massive escalation, not only in the humanitarian crisis, but also in the long-running education crisis that's impacting the country, which will impact future generations. So if the conflict escalates further, we can really see a catastrophic situation for children in the country who are already living and surviving in very difficult conditions.
And what might be the mental health ramifications of this? I mean, aside from the obvious physical injuries and the tragic deaths that we've seen, are you already getting a sense of the kind of impacts on children's mental health?
Indeed, speaking to our teams last night and those who have been working with the displaced communities, they've told us that families are showing clear signs of trauma and stress. Children are crying consistently. In some cases, they were just vomiting all the way on the road, fleeing their villages, and just with a desperate uncertainty as well of being ripped from their homes, from their schools, from their neighbours, from their communities, their grandparents they've been separated from, and to be in a strange place, isolated from everything that gives them comfort. We're seeing high levels of distress among children. They will need a lot of support in the weeks and months ahead, and resources that currently are just not available in Lebanon.
And lastly, the UN's also working in Gaza. Can you tell us a little bit about the challenges that the agency is facing now to help Palestinian children?
Indeed, we continue to deliver on the ground as well in Gaza and amongst the Palestinian community as well in Lebanon. It's a very, very difficult operating environment for our colleagues there and for all the UN humanitarian team there. But they don't give up, and every day we have food and essential supplies and medical supplies, as well as essential water equipment ready to access these very, very difficult areas when they are given the access.